coagulopathies. Is that right?
Sounds good.
Okay. Okay, so things the mom is at risk for after giving birth is UTIs, endometritis, retained placenta, coagulopathies, lacerations if she's had one given birth, hematomas, mastitis, wound infection. She's at risk for the postpartum blues, depression, and psychosis, hemorrhage, uterine atony, deep vein thrombosis, which DVT, subinvolution or inversion of the uterus, and pulmonary embolism. The baby, just on her baby herself, was what I was focusing on. Things that could happen to her is hyperbilirubinemia, respiratory distress syndrome, SIDS, and newborn infection or sepsis. Safety we went over was no sleeping on the stomach, hand hygiene, do not leave unattended with pets or small children, avoid cigarette smoking, temperature control, keeping the crib clear with no loose objects or blankets, fire hazards, which would be like keeping the crib away from anything where if you get started, having fire extinguishers available, having the fire alarms. Keeping small objects out of reach because they are children. They don't know what they're doing. If they put something in their mouth, they could choke on it. Even like putting the crib right next to the blinds and the cord off that they can get to. After she goes home, things she'll need to do is they do wellness checkups for the babies. I did up to 1 year. She'll want to do that initial follow-up 2 to 5 days, 1 month, 2 months, 4 months, 6 months, 9 months, and 1 year. She's going to want to have 6 to 8 wet diapers a day. Breastfeed about 8 to 12 times a day. You don't want to tell the mom specifically what it is because then she'll get set on that. She needs to learn to go for what the baby's cueing. Initially the baby's going to sleep about 16 to 19 hours a day. We went over the umbilical cord, can't do baths until it falls off. Some different holds that she could hold it in, the colic hold, football hold, upright position, or cradle hold. And then she can also swaddle the baby to try and comfort her. Oh, and that is her medication. That was just to show the iron, the colace, and the prenatal vitamin that she will want to continue.